Why might someone need a urodynamics test? Have you ever wondered why someone might need a urodynamics test? This specialized procedure evaluates how well the bladder, urethra, and sphincter muscles work together to store and releases urine. It provides essential insights into the function of the lower urinary tract, which is crucial for diagnosing various bladder health issues and determining the best treatment options. One common reason for this test is persistent urinary symptoms. If someone frequently experiences issues like needing to urinate often, feeling a sudden urge to go, or having trouble starting urination, a urodynamics test can help pinpoint the cause. These problems might stem from issues like bladder muscle dysfunction, nerve problems, or even obstructions. Another important reason to consider this test is urinary incontinence. This condition can arise from several factors, including overactive bladder muscles, weakened sphincter muscles, or nerve damage. Urodynamics testing can measure bladder pressure and urine flow during both filling and emptying phases. This information helps healthcare providers create targeted treatment plans. For individuals who are about to undergo bladder surgery or have had surgery related to bladder cancer, urodynamics testing can be very useful. Before surgery, it establishes a baseline of bladder function. After surgery, it assesses how well the bladder and urinary tract are functioning, especially if new urinary symptoms appear. In cases of neurogenic bladder, where conditions like spinal cord injury or multiple sclerosis affect bladder control, urodynamics tests provide critical information. They help understand how nerve damage impacts bladder storage and emptying, guiding management to prevent complications like urinary retention or kidney damage. Recurrent urinary tract infections can also lead to the need for a urodynamics test. If someone experiences these infections frequently, it might be due to incomplete bladder emptying or abnormal bladder pressures. The test can help identify these issues, allowing for appropriate interventions to reduce infection risks. Some people may struggle with fully emptying their bladder, leading to urinary retention. A urodynamics test can determine if this difficulty is due to bladder muscle weakness, obstruction, or coordination issues between the bladder and sphincter. Lastly, for patients with bladder cancer, monitoring bladder function is crucial. Treatments such as surgery, chemotherapy, or radiation can affect how the bladder works. Urodynamics testing can track changes in bladder capacity and function, helping manage symptoms and improve quality of life. Understanding the test itself is important. Urodynamics involves a series of measurements taken while the bladder fills and empties. Small catheters are placed in the bladder and, sometimes, the rectum or urethra to measure pressures and urine flow. While the test is generally safe, it may cause mild discomfort or irritation. In summary, a urodynamics test is a vital tool for diagnosing and managing various bladder health issues. It provides objective data that helps healthcare providers tailor treatment plans to enhance urinary function and overall well-being. If you or someone you know is experiencing persistent or complex urinary symptoms, consulting a healthcare professional about the possibility of urodynamics testing is a wise step.